I'm Olivier Sitbon. I'm a professor of respiratory medicine at the South Paris University in Le Kremlin-Bicêtre, a location in the south of Paris. And I also work in the French Referral Center for Pulmonary Hypertension in Bicêtre University Hospital. In the next future, we have to do some progress in different directions. Of course, in basic science, to know better the pathophysiology of the disease, in genetics, by the discovery of new genes, and how to deal with these new genes to develop new treatments. I think that's an important point because for a long time we did not develop new treatment, and all the new treatments that have been tested, it is important to develop new treatment as the new treatment we have today, when they have been tested in phase 2 studies, for example, all the studies are negative for many reasons. I don't want to go too much detail about that. So we have to work a lot on this topic of clinical trials. First of all, to develop new drugs and also to develop new trials in patients with pulmonary arterial hypertension. And also we have to better use the treatment we have, because we have at least 10 drugs available, and with a better knowledge of how to use them, we can probably improve the long-term outcome of patients with pulmonary arterial hypertension. From the beginning of my fellowship, I was very interested in pulmonary vascular diseases, and in particular to pulmonary hypertension, and especially pulmonary arterial hypertension. Then I became a consultant in this department, and then a few years later I became a professor of respiratory medicine, mainly specialized in pulmonary vascular diseases. In the beginning of the 90s, I was very impressed by the patients suffering from pulmonary hypertension, and we didn't have a lot of treatment for those patients. I was very interested in the care of those patients, how to improve their symptoms, how to improve their outcomes. So I decided to work a lot on this topic, and finally we were the first to utilize the first treatment for those diseases, and I observed regularly the improvement of my patients using more and more drugs targeting the different dysfunctional pathways in PAH. I think that this new association will be very useful in our practice and to improve the knowledge in the disease. Until now, we just had a World Symposium every 5 years, and finally people work on the different topics just before the different World Symposia. So now we have the opportunity with this association to develop new ideas, to propose new studies, and finally we can work we have time, we can much before the new symposium will be held in the US in 2023. But now we can work in advance, and we can work all together to develop some projects and some potential studies to perform in patients with pulmonary arterial hypertension. Until now, we had regular World Symposia every 5 years, and the people worked just before the date of the symposium. So now with this association, we have the opportunity to work more in advance, because the next symposium will be on 2023 in the United States. So now we have the opportunity to share ideas, to propose some projects, some trials in advance, and to discuss with all the experts in the field of pulmonary hypertension in advance before the next World Symposium.